My name is Monica Flores Romero, physician assistant. I'm 31 years old and I've been working for almost 2 years in critical care. I went to Florida International University for my undergrad in a bachelor's in health science, then received my master's in athletic training, and I went on to pursue a degree in physician assistant studies at Miami-Dade College. Prior to applying to physician assistant school, I worked for 4 years as an athletic trainer at a local outpatient physical therapy clinic and local high school. I also shadowed a family medicine PA for 2 years. My patient care experience consisted of 2,500 hours, which included working full-time as an athletic trainer for 4 years and my shadowing experience with a family medicine PA. My GPA upon graduation from my master's was about a 3.3 to 3.5, and I had to retake all my prerequisites because they were outdated, and I was able to get a 3.9 GPA in my sciences.
Hey everyone, welcome back to my channel. My name is Kendra and I'm a physician assistant in aesthetic medicine. So yesterday I was able to sit down with Monica, who's a physician assistant in critical care, and asked her a bunch of questions to get you guys an idea of what a day in her life is like. I apologize in advance for the loud background noise from the air conditioning machine. I didn't notice it until after the fact, but I hope you guys enjoy anyways. So let's get into it. So what does a typical day at work look like for you?
A typical day as a critical care PA consists of getting to work at 7 a.m. and printing our list for the day of the patients that we're going to be covering. And we do physical rounds. We address any issues or emergencies that may be happening. And then a little bit later, we round with the doctors. We go through every single patient's chart. We wait for laboratory results to come back from the morning, and individually with the doctor, we go through every single patient's chart, review, labs, treat, what we need to treat, basically consult with other physicians on the plan of care for the patient, as most of these patients have multiple specialists on their case.
So do you see like new consults and follow-ups and stuff like that?
Yes, so we see new consults throughout the day that are either pulmonary consults or ICU consults, and then we usually each take care of a unit of patients in the ICU, and then we have telemetry or med-surg patients that are pulmonary patients that we follow up on.
Do you do any kind of procedures?
So currently our practice does not include intubations, PICC lines, central lines at the moment because we are an open unit, but we do have specialists or physicians that are there with us that perform those procedures if needed.
How long are your shifts?
Our shifts are 12 hours. We work about 14 to 15 shifts a month, and our schedule varies. Some days it's 2 days on, 2 days off, 5 days on, 5 days off. Or sometimes we work a week straight, which is very common in the ICU or internal medicine setting, and then we get a week off.
So would you say you have a good amount of free time or time for yourself?
I would say that definitely our schedule makes it very easy to take vacations, have days off, and make switches amongst ourselves. But when we are there, it is very demanding physically and mentally. So sometimes you need 1 to 2 days to have for yourself before you can think about doing other things.
Yeah. How many physicians and PAs are in your practice?
So currently we have about 5 physicians, if I'm not mistaken, and approximately 25 mid-levels, including nurse practitioners and physician assistants.
So with 25 PAs or nurse practitioners, do they have good access to speaking to the doctors if they need to talk to them?
Yes, so if the physician is not physically with us, we are a text or a phone call away from them, and at any moment if we need something or if there's an emergency, they come right in and help us.
Awesome. How long would you say it took you to get comfortable in your job?
So I would say approximately 6 months it took me to feel somewhat comfortable, but every day in critical care is a learning experience. Not one patient is the same, and like I said, these are very sick patients that have multiple comorbidities, but having so many other mid-levels that work with us, we really help each other at any time we need, and they teach us so much.
Nice. What would you say is the hardest part about your job?
The hardest part of our job is definitely feeling that you didn't do enough, even if you did everything you could, because a lot of these patients come in so sick, or they come in, not quote you would say too late because they have so many comorbidities, or they haven't been taking care of themselves. So when you do get them, they're very unstable, and to try to stabilize them sometimes you know, we have a positive outcome, sometimes we don't. And those negative outcomes can sometimes get to you because, like I said, you feel like you didn't do enough, but you did.
So how do you overcome that for you?
Initially, there were a lot of tears, but you learn to have tough skin, and you learn, you know, how to get through those moments, and you have to kind of wipe your tears and keep moving because there's other patients that need your help.
What are your hobbies when you're not at work?
Well, my hobbies when I'm not at work include spending time with my husband, my dog, and I enjoy taking different workout classes, including Pilates, yoga, boxing, which also helps decompress and de-stress from the workday.
So, do you feel comfortable telling us your salary?
Well, since I'm currently working at my position, I can't disclose too much, but I would say that critical care, along with emergency medicine and dermatology, are the higher paying positions, which usually start in the 100,000 range.
What are the most common conditions that you treat?
In the CCU, we see a lot of different conditions and comorbidities, which include acute respiratory failure with ventilated versus non-ventilated patients, pneumonia, COPD or asthma, influenza, pulmonary embolism or deep vein thrombosis, coronary artery disease, congestive heart failure, drug and alcohol intoxications, upper and lower GI bleeds, and a multitude of post-operative patients, including cholecystectomies, laparotomies with colectomies, plastic surgery complications, and peripheral vascular disease with amputations.
What would your advice be for someone who wants to practice in critical care?
I would say the best advice, especially if you're already in PA school, is to make all your electives critical care, trauma related, so you can get the most experience as possible. And networking is a huge thing, so making sure that you show up on time, you're responsible, and even if you're not in PA school, getting a job in the hospital setting, because you're going to meet so many different physicians that can all open the door for your next opportunity.
What other field could you see yourself working in later on, if ever?
Prior to working in the ICU and to PA school, I worked in the sports medicine field as an athletic trainer, so I could definitely see myself in the orthopedic setting since I did have experience and that was my first passion. And I also love dermatology and aesthetics.
So what would be some of your favorite resources that you use?
Some of my favorites that I use on a daily basis are Up2Date, Medscape, Hippocrates, and MD Calc. Medscape, MD Calc, and Hippocrates are all free. Up2Date is a little bit pricey, but definitely worth it if you want to make an investment, especially as a student, that you will use no matter what specialty you work in.
So your last question and final question, that's the same thing. What is your guilty pleasure?
That's a tough one because I have a lot. But I would say number one is reality TV. I don't understand why I watch it. I feel like I lose brain cells watching it, but it's nice to watch people make fools of themselves after a long day at work.
Alright guys, that's all I have for this episode of Day in the Life of a PA. I hope you guys learned a little bit about critical care, and if you haven't subscribed to my channel, go ahead and hit subscribe if you want to, and hit that bell so that you guys don't miss any new videos from me. I'm also posting every Thursday now, hopefully, so expect a video from me a week from today. Also, if you have any questions, like usual, comment down below. I do like to try to answer everybody, so just give me some time to get back to you, and I definitely will. And other than that, I will see you next time. Bye!